In our final series of head injury assessment videos, I want to teach you a little bit about cranial nerve assessment. There are 12 cranial nerves, and they should be assessed immediately after injury and then in 15 to 20-minute intervals until intracranial bleeding has been officially ruled out, which typically can be done through imaging. So since there's 12, it can be very difficult to memorize or learn all of them. So I like to use a little acronym to remember the names of them. And that is, the first three have to do with the letter O. So I do O, 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 to touch and feel, very, green, velvet, ah. The ah is AH, which is abducens and hypoglossal. So let's walk through cranial nerves 1 through 12. Cranial nerve number 1 is olfactory. That's where you're testing for smell. Usually an ammonia tablet would be most helpful. The second one is optic, which is going to inspect visual field. So there's multiple components. Ocular motor, which is number 3, that has pupillary reaction and then also movement of the eyelid. Trochlear, which is going to be upward eye movement. So there are several that have eye movement associated, trochlear being another one of them. Trigeminal is going to be where you're moving your facial muscles, so mastication is one of those. Abducens will be looking to the lateral aspect, so it's not movement of the head, it's actually movement of the eye to the side. And facial is going to have a mix of motor and sensory, so there will be expression and sensory testing. Vestibular cochlear is the one where we're going to assess hearing and then also balance that equilibrium. Glossopharyngeal is swallowing, as well as the taste test. So sometimes we'll have some glucose tablets nearby or candy, something of that nature. You can kind of assess their ability to taste that thing and identify what it is. Vagus is going to be the pharynx and larynx, as well as the gag reflex. We'll use a tongue depressor just to assess that they have a gag reflex, but be careful because vomiting is a side effect or symptom of concussion, so you don't want them actually to vomit. Also, we have accessory, which is the sternocleidomastoid muscles. You can have them press up against your hands. And then the last one's hypoglossal, have them stick their tongue out. And if they can't move it to the side, sometimes that's a positive as well. So looking at each of those, identify that some cranial nerves have a motor component only, meaning some sort of movement, contraction of the eye, mastication, something of that nature. Some only have a sensory component, which means they'll be using one of the 5 senses. Olfactory would be one of those because you're using the sense of smell. Some have multiple components, whether it's 1 sensory and 1 motor, 2 sensory and 1 motor. Those are going to vary. So remember when you're learning these to identify those that have multiple components. Those are probably the most difficult to learn. But as you study them, if you can associate that one nerve with those multiple components, it will help you to know which ones are most complex in assessing the cranial nerves. So I hope that helps you, and good luck.